Very good evening, friends. Meeting in the session of philosophy, and we are on concluding session of the third year's philosophy, Robert's philosophy syllabus, and the chapter number 34. That's what we're going to learn in today's session. The chapter name is rather different. It has been mentioned over there. It is the deflected current. What exactly Robert want to say in this chapter? That's what we have to learn in this specific session. So open your books. We'll start directly with the chapter. Chapter number 34, the deflected current from H. Robert. We are told that light waves travel in certain directions until they meet some obstacle. When they are deflected at an angle proportionate to the angle of interference. We are told that our remedies are curative in conditions closely similar to those produced by the remedy in healthy human being. So what he is explaining, he has started the introduction to this chapter, and he starts giving example of light waves. Whenever light waves travels, unless and until there is some obstacle in the process, they never gets deflected till that they goes on in a proper direction. He is comparing it with the homeopathic remedies and action of the remedies over here. He wants to explain that, yes, this is how it goes on. So, he explains it and then he starts the science of optics. Optics means related with the vision. The science of optics can give us, with very small percentage of error, the measurement of light waves, their angle of deflection, and the measurements of necessary to correct vision or to utilize light waves in some practical manner. In other words, there is a definite measurable approach through known laws to the application of light waves to our modern needs. And we may be assured that with growth in our needs and greater understanding of those laws and measurements, future generation will be able to utilize light waves to a far greater degree than thought of at the present time. Now he is comparing it with the optic waves, because of which we are able to visualize the things. The rays goes inside our eyes. If there is minute error, we are not able to visualize the things in a clear way. The vision gets obscured, and in such types of cases, we have to correct it with the proper measurement. There are different methods developed to find it out, the refractive error, and to reach to the remedy. Then they gives the specs according to the errors, and that refractive errors, when gets corrected, we are able to visualize the thing. The same thing he tries to explain it in relation with the homeopathy now. This is the introduction, what he wants to explain about the deflected current over there. The laws which are there in the optics, those laws of optics corrects the things, corrects the errors, and brings back the vision. These laws, once developed, if developed and continuously the evolution happens in the study of it, it goes on far beyond utilization in future. And same is true with the homeopathy. Now he compares it with homeopathy. The homeopathic laws are fundamental. We understand many of them. We utilize them. Unfortunately, we have no such instruments of precision by which we can measure the obstacles to the curative waves of our remedies. Therefore, we have no uniform results from our remedies, such as we might expect from the vast armamentarium of remedies. Armamentarium means showcase, or our remedy self is armamentarium. Armamentarium of remedies, and the compilation of knowledge and experience garnered by successful homeopathic students since the time of Hahnemann. So what he is explaining, there are also homeopathic laws. They are fundamental. We understand them. We understand all 7 cardinal principles. We utilize them. But the error which we can measure with the help of optics, Such types of error, measuring the error is not possible when we deal homeopathically with our remedies. It varies because there is a question of judgment comes. The susceptibility we have to judge, and accordingly we have to select the potency. We have to find it out the simillimum on the basis of available totality of the symptoms. The characteristicness of it should be there, then we come to the precise remedy. Sometimes we might not. So such a thing is not so clear with homeopathy as happens to be there with optics, because the things which you can measure in case of optics, here the things you cannot measure in case of homeopathy. The dynamics, whenever the question relates to the dynamics, the question of measurement comes. And what he says, some our confreres means sahakari, partners. Some of our confreres will say at this point that such instrument of precision are being used by homeopathic physician at the present time, that they are daily being perfected and that the results are increasingly satisfactory. No doubt all of this is true. Yet, for average homeopathic student, we feel that such means are not yet available, or if available, the technique has not been sufficiently mastered by the average physician to be handled with accuracy, or perhaps the degree of perfection or imperfection of such instruments interferes with the capable of usage. So, because such a thing, such a instrument which are there in the field of optics, such an instruments which are not there with us. Nowadays we have a computer. Nowadays we have software. Yes, the benefit have definitely occurred. Earlier, whenever we used to repertorize the case, we have to do it manually, and it used to take a longer period. Sometimes chronic case, when we used to solve, it used to take 2 hours to repertorize and to come to the conclusion. But because of the precision of instruments like computer and softwares, it is possible now to repertorize case within a minute. You are coming to the conclusion within a minute, and that's why many errors now we can reduce because of repertorization method, and we are able to do it in post consultation as well as follow-up consultation. So things are changing, and things are changing in right direction. If you utilize computer in a proper manner, you will definitely use or you will definitely use to reduce your errors because of proper use of it. However, this may be our thesis has to do with the average homeopathic physician and may be reduced to that all too well-known questions. Why are our results not uniformly satisfactory? So, in this chapter, he wants to highlight certain points. Why there is a variety, there is a change in prescriptions of the same case in different people. So first question he puts, why are our results not uniformly satisfactory? And number 2 question, why doesn't the seemingly indicated remedy always work? So there are 2 questions which arises in everyone's mind, that why the results are not uniformly satisfactory. Sometimes we get very perfect results, sometimes we cannot. Why this is so? Why you are not coming to a very perfection and 100% result? That is the first question. And why, even though you finds it out very perfect similar and remedy is not acting? And those he highlights over there in this chapter. What he says, of course, there are the answers known to every physician of whatever school, and some that only homeopathic physician recognizes. So there are certain answers, there are certain explanations. One obvious reason is the pathological condition of the patient. The rheumatologist and the surgeon, rheumatologist means radiologist, rheumatologist and the surgeon are more apt to know about such pathological obstacles, that is the homeopathic physician, but they so lack the mean to cure that their knowledge teaches them only to remove offending tissue. Perhaps the patient recovers by the aid of the beneficent nature. It is the trite but true that more mistakes are made by not looking than by not knowing. A difference is that in modern science, this radiology makes the difference. They labels the disorder. Yes, you are having a certain liver cirrhosis, you are having a hypertrophy of the heart, you are having hypertrophy of the certain parts, or there is a tumor, there is a growth, something like that. If this, if you understand this disease, but if you don't understand what is the core of it, why this has happened, and if you try to treat it with in the similar manner as the surgeon treats it, then definitely you will not going to get the results, because you are dealing with the end products. Any growth, any pathology is the result of disorder. Any pathology is the result of disorder. It is not the cause of the disorder. So whatever may be the pathology, it is end result. Where do you focus when you treat the patient? And many physicians never understand. They understand that this is the disease, actually, which is not the disease. And if your concept is not clear, there is always a difference in the opinion and the treatment part of them. And then he further says, on the other hand, there are serious homeopathic students who have come to believe that the treatment of pathological condition by X-ray or radium dissipates rather than cures the pathological tissue. Certainly, we have seen the results of overexposure to such treatments with the insuperable obstacle to cure that has been thus raised, destruction of the normal tissue. Under such treatment may prove as dangerous to the patient's health as lack of treatment, and the relation of metastasis to surgery, X-ray or radium treatment is still an open question in the minds of many close observers. So what he is saying? He is saying that if you know what to treat, then it is possible to treat the pathology. Many of the people never knows what to treat in pathology. They still finds it out the results or remedies on the basis of only pathology. And once you look towards the pathology, you are coming to the common symptoms of the pathology, not the characteristics where one can individualize the remedy. One can individualize the person. If you have, if a patient is having specifically a liver cirrhosis, the common symptoms of liver cirrhosis you can get, and you cannot come to the conclusion. You are going to find it out common remedies which will not going to work unless you have very specific characteristic symptoms, or if you have symptoms prior to the development of this pathology, which will guide you to come to a right remedy in such types of case. So the way the disease has started, if you are able to locate it at that level, or if you are able to find it out those symptoms which are prior to the pathology, then it is rather simple to reach to the remedy. But with pathology, you cannot. And that's what one must know. X-ray will not going to give you anything, or there are many treatments. The surgery will not going to cure the patient, even though you remove that growth completely. You find it out that there is a case of CL breast, and they do the mastectomy, then radical excision and everything. And within span of 6 months or 1 year, there is a metastasis and patient dies because of it. They give the radiation to kill the cells, till patient dies. Why? Why there is metastasis? Why the disease gets adverse? Because you have not treated the cause of the disease, you have treated only the end products. because of which the axis of the disease has changed. It has changed from one direction to the another direction. There is a deflection, but cure never happened. If you would have treated the root cause of it with the help of understanding the miasmatic focus, understanding the patient's complete history, and if you are able to reach to the right remedy and use it in proper potencies, then if that cause which was causing the trouble, if it has got treated, then such pathologies can get completely cured, otherwise not. So the concept of disease is very important. Once you understand what is exactly the concept of disease, then it is possible to treat it in a proper manner. Otherwise, it becomes an obstacle in the process of recovery. You cannot reach to the right remedy on the basis of knowing only the pathologies. Pathology one must know in order to understand disease process. Pathologies one must know in order to understand or to find it out the prognosis, but they will not guide you to reach to the remedy. Only thing they will guide you to understand what miasm is lurking behind, how much depth the disease is having, but it will not guide you to reach to the right remedy on the basis of any specific pathology. Then there are states which arise from the mechanical obstruction, non-pathological but actual presence of a foreign body, which gives rise to the reflex symptoms of exceedingly troublesome nature. Of course, the remedy does not and cannot cure such symptoms as long as the causative factor remains. Persistent earaches or coryzas in children who have inserted small objects into the ear or nose have their counterparts in the sufferings of adults, often from unusual minor accidents. So this is again one more place where you cannot get the results even though your remedy is right. Because you have not understood from what the patient is suffering from. If the patient is having watering from the eyes, why one eye, and there is redness of eye, lot of irritation is there, and your euphrasia, argentum nitricum will not going to cure that because you have not find it out what is the cause, what is the reason because of which there is a watering from the eyes, why is rubbing, why what irritates him. And if you observe, clinically examine patient, and you find that there is foreign body on cornea, unless you remove that foreign body from the cornea, this will not going to get cured. And this is what one has to understand. Why our results are not proper or satisfactory? Because we are not understanding what is happening with the patient, what to treat and what not to treat, what is the cause and what is the root cause. Everything which you have to take into consideration. If we are able to find it out that, then it is possible to reach to the right remedy. Patient is having discharge from the ear and he is having foreign body inside the ear. Unless you remove that foreign body, discharge will not going to stop, because it is a foreign substance which is irritating over there. No remedy will going to remove that. So this is what he wants to explain, that you must know what exactly the disease is. Psychic trauma, emotional stresses of varying degrees, and the insistence are factors that we as homeopathic prescribers should understand and weigh thoroughly in the view of patient symptomatology. However, frequently the patient does not consider his private affairs the business of any outsider, even of the physician, and keeps these important items to himself. Or he may be so used to bearing his own burdens that he does not recognize them as having any weight in the case. He may consciously or unconsciously distort the picture of his own mental stress so much that even if he reveals the difficulty under which he is laboring, and the whole picture may be of little help to the physician in analyzing the case. So there is one more thing where the physician should look. There are many features. There are many features which are dynamic, which are behind the physical disorders. Those are present behind those disorders at the level of mind. So he has used the word psychic trauma. Psychological trauma is in the form of some grief, in the some form of some mortification, anything. Emotional stresses of varying degrees, those are quite common with the human being because he is emotional. And the insistence are the factors that we as a homeopath prescriber should understand. If they are present, and the reaction to them, one must understand, then you will understand exactly the totality. The cause and effects, both you have to take into consideration. It is not only the effect which will guide you, but at the same time, along with cause, the effects are very important in order to find out exactly the remedy. Here, if you don't go into the depth of case, you are not going to find it out what is the reason behind the pathology. And this many times you never get it from patient because patient is not familiar with you regarding this. If you, unless and until patient you gain the patient's confidence, you are not going to get the details every time. Some patients are quite reserved, some patients are quite secretive, some patients are very taciturn, and some patients they don't want to open or get open their emotional stresses or emotional entity. And in such cases, you miss all those things and you will not reach to the right remedy. And if you are not getting the proper picture, if you are not getting the proper detailed history, you are nowhere in homeopathy. Then you have to go with zigzag way. Then you cannot reach to the right remedy on day one. And because of which it happens many times, the not satisfactory results are during the first prescription. It was Hahnemann himself who emphasized that the fact that nothing was so deleterious to health as unhappy domestic condition. That these conditions could and often did prove unsuperable obstacles to cure. It is fortunate that the similimum often can take the additional tension from the patient and may lift off one series of symptoms. But so long as these strains persist under the surface, one cannot expect the cure. Nevertheless, if the physician does not realize that these underlying influences exist, he may fall so far short of helping the patient that he may imperil his own belief in the homeopathic possibilities of cure as well as confidence of the patient. So, he is explaining certain obstacles in the process of cure. One obstacle he explains over there that many times there are unhappy domestic conditions, and it may be one of the cause behind the disorder. If you are giving right remedy, but the condition is not improving, that's why Hahnemann have mentioned very clearly the mental regimen while explaining the mental disorders. In the aphorism number 228, he has mentioned how the physician and attendant's behavior should be toward the first type of mental disorders. These are very essential. What should be the surrounding? Because it matters a lot. Even though you have selected a very correct remedy, but the surrounding of the patient is not good enough. It is unhappy. It is producing a depressing effect. There are quarrels continuously going on. You cannot cure those patients unless and until you develop whole thing or understand the whole thing. And these becomes obstacles in the process of cure, and that's why you never get satisfactory results. He's explaining all those points why we are not giving every time the satisfactory results. I think we'll stop over here and we'll continue with tomorrow's session with the rest of the chapter. All those points which he has explained over there are the obstacles, practical obstacles which we used to face in our day-to-day practice. So go through this chapter and understand exactly what Hahnemann wants to explain as well as Robert wants to explain regarding the unsatisfactory results. So that is what is a deflected current. Even though you are going in right way, why the obstacles comes? That's what he tries to explain over there. Many times it might be a use of scents is obstacles, use of different creams is an obstacles. Many types of obstacles comes in the process of recovery, and that's what we have. That's the thing which we have to learn in this chapter. So thank you being there, and today evening we're going to meet again with the remaining part of the last remedy, that is the stramonium part 2 at 8:15. Thank you.
Thank you very much, sir.
Thank you, sir. Have a good evening.
Okay.